On the line with us, Sara Robinson. She is one of the few trained social futurists in North America, a consulting partner with the Cognitive Policy Works in Seattle, founding member of the Group News blog. She works with the Campaign for America's Future, a fellow with the Campaign for America's Future. Ourfuture.org is that website. And Sara, great to have you with us. Great to be here, Thom. And you have lived in Canada for 5 years. You live there right now. You have done some rather extensive analysis. In fact, the articles that you've written, in particular one called the Healthcare Debate Another Country Heard From by Sara Robinson, has shown up on just about every website that I can find. It's all over the internet. It's totally gone viral. And so I wanted to get you on to just answer some of the questions that Americans have about the Canadian healthcare system. Sure. Number one, it's a bureaucracy that gets between you and your doctor. There is no bureaucracy that gets between me and my doctor. It's one of the wonderful things about it. If I need to go see the doctor, I call him up. A couple days later, I go in. I hand them my card. My bills are paid. He doesn't talk to anybody at the insurance company. I don't talk to anybody at the insurance company. There are rules. Everybody understands how they work. He goes home in time for dinner and takes Thursdays off. It's all good. Okay. What happens if somebody loses their job? You stay covered. You're covered for life, cradle to grave. What about the wait times? This whole thing that Canadians can't get the procedures that they want. That people are dying. They're not getting fast enough cancer treatments. They're not getting fast enough heart attack treatments. They're coming to the United States in droves to get high quality, top notch health care. It's a really interesting question, because in urban areas of Canada, that's generally not true. Some provinces budget themselves better than others. The health care is run at the provincial level, which is like the state level at the U.S. And I should mention here that the U.S. proposals, by and large, also want us to run things at the state level in the U.S. And that's where SCHIP is run, for instance. Right. So in Canada, that's how they're all provincial plans, and they vary a bit from province to province. Some provinces manage their resources better than others. Some have bigger populations and can afford more. One of the interesting things is I started writing about this about a year and a half ago, and I've heard from Canadian doctors and nurses and users, by and large, very positively, but the complaints that I have heard almost universally have come from the single province of Ontario, which tells me that Ontario probably has issues that most of the other provinces don't, which is to be expected when you've got 13 provinces running separate systems. Right. So somebody's always going to get it less right than somebody else, and I suspect that if America goes to some kind of universal health care, we're going to see similar variations. Yeah. That's very interesting. Yeah. Private insurance, does it exist in Canada? It does exist. How does it work? There is a role for private insurers to provide supplemental insurance. The provincial plans only provide the basics. Here in BC, I get all doctor's fees, all tests, all treatments, ambulance care, and anything that happens in a hospital. We don't. So all of that is free. And that's all free. Anything that happens in a hospital, you're not charged $50 for an aspirin. You don't. If you need heart surgery, it doesn't cost you anything. That's true, yes. Okay. Absolutely. I had an angiogram about a year ago, and it was a $30,000 procedure, and I walked out without a cent. So it's absolutely amazing if you're from the American system and are used to the way that works. Right. But there are extras that are not covered, prescriptions notably, in BC. Alberta does cover prescriptions. They've got a lot of oil money, and this is how they share the wealth. That's interesting. So one province does cover prescriptions and another one doesn't. Right. There's a basic standard of care that the federal government mandates, and BC is just slightly above that standard. And other provinces, if they're a little more flush, can provide more. But prescriptions are notably not covered. Medical equipment, physical therapy, chiropractic, vision, dental, mental health. So all that stuff is covered by supplemental plans, which are offered by private insurers. And because the private insurers aren't having to cover the big-ticket items, which are very high risk, high liability for an insurance company, these policies can be very inexpensive. Small employers can offer them. A family of 4 on a group plan can get $200 a month. Is all they're paying for that. For a policy that covers all those extras: dental, vision, mental health. Right. What about things like very elective stuff? Not hip replacements so much, but liposuction and cosmetic surgery and things. In your dreams. Yeah. There's no insurance company that covers those.
No, it's just like in the States.
That's just stuff you have to pay for out of pocket.
Right, absolutely.
Okay.
But the stuff that you need will be covered. And certainly, for instance, plastic surgery, if you had a disfiguring illness, if you needed a breast reconstruction or your face was banged up in an accident, definitely the provincial plan would cover plastic surgery.
That's all covered by the basic stuff.
Right, exactly.
Very, very interesting. But wait times in general, that you said, some in Ontario they're having some problems, but are these life-threatening problems?
They're very careful about the way they triage things. It's a much more tightly integrated system. And so, for instance, if I have a knee problem that's been bothering me for a year or two, and I go in and the orthopedist says, yeah, we'll get you on the list, that could take 6 months. I've had neighbors who have waited about that long. But the reason I'm waiting 6 months is because the older lady who fell down and broke her hip and needs an emergency hip surgery today is going to get it today.
Right.
And it's a moral no-brainer.
Right. Yeah.
I have to wait because she gets hers.
A moral no-brainer. Well said. Sara Robinson, ourfuture.org, the website. You can read her writings. Sara, thanks so much for being with us.
Great to be here, Thom.
Great speaking with you. 27 minutes past the hour. 866-987-THOM, our telephone number. Back with your calls and thoughts on this and other news of the day. Right after this. ThomHartmann.com, by the way. Drop into our live chat room.